Oh, right. This is the power and talk of COVID-19. What to do when our city opens. This talk originally was in Chinese, but I'm recording this for my English speaking friends. Any comments or suggestion would be most appreciated. And this is just more of a sharing of ideas. It's by no means an official statement of anything or anybody. It's just myself, it's just my readings. Thank you for your time and thank you for listening. So this disclaimers, this talk recorded on my laptop is not sponsored by any organizations or products. It is my personal opinions as an internal medicine physician working as a hospitalist with some experience taking care of COVID-19 patients. It is for your education and hopefully entertainment. But by any chance, any means, it's not a personalized medical advice to you because I haven't seen you. So no doctor-patient relationship is established here, and I cannot take any credit nor responsibility for any decisions that you can or will make from this talk. But I hope this helps. So three objectives. Number one is my view on the current status of COVID-19 in our community. In this case, is California. Second objective is the best way, in my opinion, to protect yourself and your family. And as you do that, you protect me and my family. And lastly, just want to share a few words that's been on my heart. So objective number one. Uh, yeah, what happened? Didn't seem too long ago, we see the first cases coming from China, Wuhan, and seeing there the city locked down, and everything just seems so far away. And as we see cases spotting out on the news, a few hundreds, we don't know it will become like this, where now United States is the most infected country in the world. We have 1 out of 4 people in the world infected with COVID-19 is from the US. And we have, as of today, which is May 14, 1.53 million people infected. And of those, there's more than 90,000 that has died from this disease. Hard to believe. And the worst hit nation area of our nation is New York. So this is the New York State. It's somewhat helpful to bring some perspectives to compare and contrast different states, which sometimes seems like different countries. The United States is so big. But this picture is from Google, of course, and seeing all these patients that have no bed and they are just laying out there as makeshift beds. The picture on the left is the body being loaded on the ice truck. And it's just hard to imagine, this is our world now. So what happened? The main difference is the infection rate. Um, so if everyone can recall, around February time, the things feels pretty normal, and we start seeing our first cases in the beginning of March. This is the infection growth rate of New York State. The infection growth rate of 1, meaning that one infected person will transmit the disease to one more. So it means the growth rate is exactly 1. It's not becoming bigger, and it's not also becoming smaller, steady. So the CR growth rate in the state of New York, it went up. In the beginning, it's already more than 1. To give our listener a reference, to my understanding, the typical seasonal flu is about 1.2, meaning that one infected person can transmit to 1.2 people. So slowly grows. Now COVID-19 is much more contagious, and you can see the infected rate goes all the way to 2.94, which means that everyone COVID-19 in the state of New York will transmit and had been transmitted to 3 more people, and the growth rate is exponentially. So so we see around the peak is before, based on this COVID Now, the website, March 16. The lockdown of New York State is on March 21st, and so after March 21st, you see painfully, actually quite a nice decrease of the infected growth rate, all the way down to 0.66. Now, that's the growth rate, because there's so many infected people. Even though the infection growth rate decreased, the rate of the confirmed cases comes down painfully slow, as Governor Cuomo has been explaining on the news daily. So we are at the other side of the tunnel now, seemingly, for the state of New York, where one person of confirmed COVID-19 is transmitted to 0.66 person. It means that the epidemic in New York is shrinking, and less and less new cases being confirmed on the news on a daily basis, thank God. So just a little bit other numbers. The positive test rate, the lower the percentage, the better it is, meaning that we're doing a whole lot more tests and pick up more patients, and hopefully quarantine and isolate them. The ICU headroom of the state of New York, this used to be 100%. It means that healthcare is completely overwhelmed. And it's also nice to see this number coming down to 78, meaning that there's empty ventilator machines, thank God, again, ready as a reserve to take care of any severely infected COVID patients. And this is our state, California, where I live in Orange County. So, and the number is not attached here, but essentially the peak of the infection growth rate, in contrast to New York, almost to 3. It didn't go higher than 1.4. So, and because we locked out 2 ways. Number one, we closed down our state, um, because our governor decided to close down earlier, 5 days earlier, in fact, around March 16. So about here. And we also closed before St. Patrick's Day. So we were escape all these outbreaks that could have happened in California, particularly in LA and San Francisco. And the infection rate has been coming down steadily since the lockdown. It has been painful. I know, everybody knows, some more than the others. So the infection growth rate right now is 1 to 1.04, which means that you see that confirmed cases not coming down is because each infected person is, before they get better, they infect one more. It's just hard how contagious this is despite the lockdown. The positive test rate is rather low, so is the ICU headroom used. In my experience, a lot of California hospitals have a lot less census and a lot more empty beds. Um, but we have plenty of resources as of now to take care of any possible future infected COVID patients, or really any patients. Our hospital is ready to take care of anybody. So the state is about to open up. What would happen if our lives go back to where it was? Exactly the same amount of travel, the same amount of gathering, churches, restaurants. What would happen? Well, as of now, the only way to get herd immunity is through vaccines, or more people get infected. Based on models, it has to be about more than 70% of the people gets infected to have enough antibodies in our community and have a herd immunity. So the infected patients will give their transmission to someone who already has antibodies, and that way the epidemic slowly dies off by itself. But the price is death. If 70% of the state of California are infected. Based on this model, 21,000 or more people would have died because of the mortality. It is highly debatable, but without questions, if all restrictions are lifted and we just let this thing run rampant, people will die, a lot more people. To summarize above, our city and our community is about to be quote unquote opened. Um, but our life wouldn't be going back to normal in the foreseeable future. The only way to reduce or control the infection growth rate is by what we have been doing, which is limiting our social circles, social distancing, and the mask wearing. So we'll have to try hard to suppress that infection growth rate. Otherwise, the number one worry in all our hearts is the second wave and the third wave of COVID infections. So let's try hard.